Setting 24-hour clinic. You see a parent who has brought her 5-year-old daughter to the clinic because a rashes appeared on her arms and legs after playing in the park. You have just examined the child and suspect urticaria, which is also known as nettle rash or hives. The child is not present for the discussion. Now let's look into the task. First one is find out more details about the rashes, such as pain, increase in size of blisters, treatment given, etc. Second one says explore any symptoms such as fever, nausea, vomiting or wheezing. Third one says find out relevant details about child, that is general health conditions or long-term medications. Fourth one says give information about likely treatment. Fifth one says advise an appropriate action for urticaria, such as washing with cold water, avoiding touching rash, using creams or rubbing, etc. Sixth one says reassure parent about actions taken, use of antiseptic cream, natural reaction, no lasting damages to child, etc. The last one says establish parents' willingness to return to the waiting room until the doctors are available. Now let's start the role play. You can start like, thank you very much, Miss Catherine, for allowing me to examine your child. Based on my examination, I understand that there are some rashes of your child's arms and legs. Therefore, I suspect the condition called urticaria. It is commonly known as nettle rash or hives, but don't be worried too much, as we have various treatment modalities to manage this condition. Before getting into that, I would like to ask you some questions regarding your daughter's condition. Is it okay with you? Then interlocutor may agree with that. Then continue by asking, okay, Miss Catherine, may I know what happened exactly to your daughter? Then interlocutor may respond you saying, nurse, she was playing around the garden and nearby bushes or grass this morning. Later, she developed rashes on her arms and legs because of that. Then ask her again, okay, does she have any pain? Then interlocutor may tell you like, no, nurse, she has extreme itchiness and irritation in her arms and legs. Then ask her, have you noticed an increase in blister size? Then interlocutor may tell you like, yes, nurse, initially the blisters were too small, but it is a little bigger now. Then ask her again, have you tried any measures to manage her condition? Then interlocutor may tell you like, nurse, I applied a medicated cream which was available at home. Then ask her, okay, Miss Catherine, does she have any other symptoms like fever, nausea, vomiting or wheezing? Then interlocutor may tell you like, no, nurse, fortunately, she does not have any of the symptoms like nausea, vomiting or wheezing. Then ask her, okay, Miss Catherine, how is her general health condition? Is she on any medications? Then interlocutor may tell you like, no, nurse, she is healthy as far as I know. She does not have any other problems. Then respond to her saying, thank you, Miss Catherine, for sharing those details. As I informed you earlier, this is likely to be a condition called urticaria, which normally happens due to the allergic reaction to plant or pollen or any other allergens. But don't be worried too much. This is not a serious condition and this is temporary and self-limiting without any medications. But she may have some pain, but it is better to go for a detailed examination to confirm the diagnosis. Then the doctor may prescribe some appropriate treatment. Okay, Miss Catherine, I hope you are following me. Then interlocutor may tell you like, nurse, I understand that. However, how are you going to manage this condition? The responder saying, your worries are completely understandable, Miss Catherine. The possible treatments are oral antihistamines, which helps to relieve the inflammation and itchiness, as well as some cold compress can be applied on the affected area. In addition to that, I can also suggest a few more measures to manage the condition. May I proceed to explain that in detail, Miss Catherine? Then interlocutor may agree with that. Then continue by saying, it's a good idea to wash the area with cold water, but avoid touching the rashes or rubbing them because this can make the symptoms worse. Do you have any more questions for me, Miss Catherine? Then interlocutor may ask you like, nurse, as I told you already, I applied cream to manage her rashes. However, I could see some kinds of reaction after applying the same. Then what do I do? Then responder saying, I acknowledge your concerns, Miss Catherine. Antiseptic cream may cause natural reaction initially, but they will not cause lasting damages to your child. Okay, Miss Catherine. Our doctors are currently busy with some critical patients, but they will be available within few minutes. So you can please wait in the waiting room until they are available. Is it okay with you? Then interlocutor may agree with that. Then continue by saying, I really appreciate you, Miss Catherine, for your willingness to wait for the doctor. Do you have any more questions for me? Then interlocutor may tell you like known as thank you. Then you can wind up the roleplay by saying, okay, Miss Catherine, I would like to recap what we have discussed until now. So far, we've been discussing about your daughter's current condition, its possible causes, and treatment options. As I mentioned to you already, I'm going to make an appointment with my doctor. You can meet him in a couple of minutes. Until then, you can wait in the waiting room. In between, if you have any more questions or concern, you can let me know. I'll be glad to assist you. Thank you, Miss Catherine, for your patience and willingness to wait for the doctor. I wish your daughter a speedy recovery. Thank you, guys. Our roleplay ends here.